Okie dokie. Now we're going to end with the arterial system and look at the major blood vessels in the body versus the veins, and then how cardiovascular training can help. Okay, so the aorta is the largest diameter artery in the body. The ascending aorta, the first part of the aorta, extending out of the left ventricle. Aortic valve lies at the root. Opposite the valve cusp are aortic sinuses. The branches of the ascending aorta are the right and left coronary arteries. So these will branch off first and supply the blood to the heart itself. Remember, the heart attack is when the blood supply to the heart is compromised. The aortic arch, it bends in the aorta after the ascending aorta. There's three branches that come off. So 1, 2, 3. You have the brachiocephalic trunk, the left common carotid, and the left subclavian artery. So you want to know which three come off the aortic arch. The descending aorta, next portion of the aorta following the arch, extends downward anterior to the vertebral column and consists of the thoracic aorta and then the abdominal aorta. So the thoracic aorta portion above the diaphragm gives rise to many small arteries to the thoracic wall and thoracic viscera. The abdominal aorta is the portion below the diaphragm, so these are a way that you can distinguish above and below the diaphragm. Gives off branches to the abdominal wall and viscera. Gives out the following major branches. You have the celiac, superior mesenteric, suprarenal, gonadal, inferior mesenteric, and common iliac arteries. So here is the heart. There is the ascending aorta. There's the aortic arch. The three blood vessels that come off of it are the brachiocephalic trunk, and that will split into the right subclavian and right common carotid. But then you have the left common carotid and the left subclavian that come off the aortic arch itself. It goes down here, and then the diaphragm, which will sit right around here. Then it becomes the abdominal aorta. Again, above the diaphragm, thoracic aorta. Below the diaphragm, abdominal aorta. You have a splenic artery that obviously supplies blood to the spleen. Here's your stomach. The hepatic artery will go to the liver. You have a right gastric artery, which goes to the stomach. The right renal artery, which goes to the kidneys. Superior mesenteric, inferior mesenteric, they're going to supply blood to your mesentery, which is the abdominal wall here. Okay, then you have the right common iliac and the left common iliac, and it'll keep going down the lower extremities. You also, here are the major arteries of the head and the neck, so you follow it up here. Off of the brachiocephalic trunk goes this way, and then you have the common carotid artery. Again, this is on the right side here. So off the brachiocephalic trunk, I have the right common carotid artery and then the right subclavian artery. Okay, and then it keeps going up. You have the external and internal carotid arteries. You have the basilar artery. You have a occipital artery. You have a superficial temporal artery here. You have a maxillary artery. You have a facial artery, a lingual artery. Okay. So if you look at this, okay, so here is the subclavian artery. That's the left subclavian and the left common carotid that goes up. Remember, the right come off the brachiocephalic trunk, but the left half come right off the aortic arch. And then we discussed these on the previous. You have the femoral artery down here, the popliteal, anterior tib, the fibular artery, the dorsalis pedis. Now, if you remember your anatomy of bones and muscles, then you can, sometimes the arteries are named for where they're located and what region of the body it's supplying the blood supply, right? The axillary artery is near the axilla. The radial artery is near the radius. The ulnar artery is near the ulna. So there you go. Okay. And then veins, you have a jugular vein. Okay, so you have a jugular vein, which is here. So there are some veins that do not have the same name as arteries. So jugular vein, you have a great saphenous vein. There are some exceptions, so you want to look at those. But usually an artery will have a sister vein that accompanies it. One brings the blood supply and one will drain the blood supply. But there are a few exceptions in the body where, for example, jugular vein, you don't have a jugular artery, you have a jugular vein. There's no jugular artery, if you see. And then this is that great saphenous vein I was telling you about. During open heart surgery and bypasses, they will use the great saphenous vein and reroute the blood supply in the heart. If you've heard of a bypass surgery, they're using this saphenous vein to bypass the part that was damaged. And then you have this basilic vein, which is in your arm, which is, you don't have a basilic artery, but you have a basilic vein. The median cubital vein right here is where they will take your blood when you go to the lab, from the medial cubital vein. And again, you have an internal jugular and external jugular, but you don't have an artery that coincides with that. Now, how many of you like to do cardiovascular exercise? Well, any activity that involves large muscles groups and is sustained for prolonged periods of time, 15-20 minutes, preferably over 20, has the potential to increase your cardiovascular fitness. The optimal cardiovascular training program depends on the age and the health status of the individual and the goal of the program. As adults age, their cardiovascular responses change. Maximal cardiac output, stroke volume, heart rate, and VO2 max all decrease. Maximal systolic blood pressure and diastolic pressure and mean arterial pressure increase. So your blood pressure is going higher, right, because your blood vessels are not as pliable as before. Now, the American College of Sports Medicine recommends the following training goals to develop and maintain good cardiovascular fitness. So you should do this 3 to 5 days per week with 60 to 90% of your maximum heart rate. So how do you find out your maximum heart rate? It's 220 minus your age. So if you're 20 years old, 220 minus 20, your maximum heart rate should be 200, and you should exercise at 60 to 90% of that. So 200 times 60 is about 120. So you should at least get your heart rate above 120. And you should do that for 20 to 60 minutes. Training intensity is the most important factor in maintaining cardiovascular fitness. To determine the training intensity, it is necessary to determine the individual's theoretical maximum heart rate by subtracting the person's age from 220. Like I told you, if you're 20 years old, 220 minus 20 is your maximum heart rate is 200 beats per minute. There's another formula which is a little bit more accurate, which is called the Carbonin formula, and is the most accepted method to determine the number of beats the heart must maintain each minute to achieve a specified intensity. The formula takes into account the cardiovascular fitness the individual already has and is reflected in the resting heart rate. So this will tell you what they say, well, okay, what's your resting heart rate? Well, if my resting heart rate is 90, well, I'm not really in that good of a shape. But if my resting heart rate is 60 or below, then I'm in pretty good shape. So this Carbonin family will take that in consideration. So for example, if that same 20-year-old individual wanted to work out at a cardiovascular intensity of 75%, and had the resting heart rate of 65, the formula would look like this: 200 minus 65, because max heart rate minus the resting heart rate, times intensity, plus 65. So you're going to get 166 beats per minute at 75%. But if we were to look at, if we just did a straight formula calculation, I'm going to do that. 220 minus 20 equals 200 times 0.75, then their heart rate is 150. So in that other formula, it will say, hey, we'll get your heart rate above 150, you'll be okay. But the Carbonin formula says, hey, you're in pretty good shape right now. You really need to exercise above 166, which is 16 beats per minute higher. So it's a little bit more accurate. It pushes you a little bit more because it takes your current cardiovascular strength into consideration. So I like this formula better. It gives you a more accurate way of telling how much to push the individual. Okay, so endurance training results. So what's going to happen when you do cardiovascular? What's going to happen in your body? Well, it's going to increase your cardiac dimensions, mass, and the size of the coronary vascular bed. Must be hungry. Bed. The internal diameter of the coronary arteries may also increase as a result of training. More importantly, the arteries are more distensible during exercise. Okay, so you're going to increase the size of those arteries. Endurance training results in an increase in blood volume, right? because there's going to be, with highly trained endurance athletes having 20 to 25% greater blood volume than untrained subjects. So somebody that doesn't train, maybe their blood volume is 5 liters, but somebody that trains, it could be 5.5, 6 liters. This training increases blood volume is primarily due to an expansion of plasma volume. Changes in plasma volume occur early in the training program, with changes between 8 to 10% occurring the first week. Early changes, 1 month, are due to almost entirely to increases in plasma volume, whereas increases in red blood cell numbers and hemoglobin occur later. Okay. A stroke volume is greater at rest, at submaximal exercise, absolute and relative workloads, and at maximal exercise following endurance training program. Your resting heart rate is going to be lower as you become more efficient. Okay. Your maximal heart rate is unchanged or slightly decreased with endurance training, so you're not going to all of a sudden have a higher max heart rate. Resting cardiac output is not changed following a training program. However, it is achieved by larger stroke volume and a lower heart rate, meaning you're more efficient. Cardiac output at an absolute submaximal workload is decreased or unchanged following endurance training program. However, cardiac output at the same relative workload and at the maximal exercise is greater following endurance training program. The increase in cardiac output seen at maximal exercise is a result of an increase in stroke volume, since maximal heart rate does not change with training. So again, endurance training, cardiovascular training is going to make you more efficient. So even though your heart rate is lower, you're pumping out more blood, so you're working, as they say, work smarter, not harder. So your heart is working smarter, not harder after cardiovascular training. In normal tensive individuals, which means you have normal blood pressure, there's little or no change in blood pressure at rest during submaximal exercise or during maximal exercise following an endurance training program. VO2 max, the amount of oxygen you can deliver to your muscles to produce ATP, increases as a result of endurance training. Improvements of 15% are routinely reported with training programs that meet the recommendations set forth by the ACSM. So you're going to get more oxygen to your tissues, you're going to feel better, and your cells are going to like you. There you go.